We're getting our first look at the renderings of the newest Norton healthcare expansion in eastern Jefferson County off I-64. You're looking at what could be the second Norton Children's Hospital in our community. This is with a major campus and hospital designed to compete with the major children's hospitals in Indianapolis and Cincinnati. The new campus will be located on more than 150 acres in Jeffersontown. Russ Cox, the CEO of Norton Healthcare, is here at 5:30 to talk with me about how you're really going to involve the community to design this campus. It's much like what I guess you learned from Norton West Louisville Hospital.
Doug, that's absolutely right. And so much of healthcare now is about trust. And one of the ways we build trust is to listen and to go out and talk to people about how they would like to receive healthcare and what they would like to see us do with this wonderful opportunity that we have for a pediatric campus. So it works so well for us at Norton West Louisville Hospital, and we just think that we should continue that practice, and that's what we're going to do.
So you've long had a children's hospital and the image of a children's hospital in Louisville, but this one is going to have different touches, different flourishes, and does it have a different mission at all, maybe a deeper mission?
It is going to carry on the wonderful tradition of Norton Children's Hospital, and we need to make it very clear to everyone that this facility will continue. We absolutely value what it provides to this community. It's grown so much that we're out of room. And we look at this as an opportunity to be something that is unlike any other place in the country. We have 155 acres that currently can become anything that we want it to be. So it gives us an opportunity to redefine care for that pediatric patient and the pediatric family that surrounds that patient. So we can design services not only to take care of the patient, we can design services that support the family while they're there as patients. And we know that that helps better outcomes, to have more family members close.
Did this plan, this idea come to you after you've heard stories over the years of people saying, I had to go to Indianapolis, I had to go to MD Anderson, I had to go up to Cincinnati?
We have always believed that we had the resources, the expertise to take care of just about everything that a pediatric patient needed in Louisville. What we lacked was the ability to coordinate it all together in one location and not be spread out throughout the downtown medical campus. So this gives us the opportunity to build it right from the beginning on this 150 acres that we have, make it very seamless to use for families, make it very easy. Our vision is that you park your car here and you're done with an auto after that. Anything after that is done through an autonomous car or through virtual means that get you to a place where you're not confused about where I need to be and when.
I know from covering you with West Louisville Hospital, you're very involved in some of the designs. Mm-hmm. Tell me what you're eyeing already that you want people to know is going to be unique. You just described one idea there.
Absolutely. It's all about removing friction in the patient experience via better process. I think there are some things that just jump out at us as we look at our pediatric patients these days and as we look at what the future looks like. We certainly want an emphasis on mental health. We want an emphasis on behavioral health. We see so many of the kids that come to us have a secondary diagnosis that is mental health. So one of the services that I want to make sure that we really do accentuate is how do we create a new model of care for that pediatric patient that does make a difference long term and that we can prove some efficacy around results. So how we design that, is it a residential type facility? Is it an outpatient type facility? Those kinds of things I think are what our charge is to really look at from a design perspective what best suits the needs of the patient and what makes it easy for that family.
So let's talk about the listening session. Tell me when and where it's going to be. You want people to come out and have access to you and your Norton Healthcare leaders.
We're going to be all over the region. We're going to start right here in our hometown in Louisville, Kentucky, right there in Jeffersontown, where we're now a part of that wonderful community at Tully Elementary this coming Tuesday, 6 o'clock. We're going to talk a little bit about what our vision is for this facility, and then we want to listen. We want to listen to the community that we've invited here to tell us how they would like to see it constructed, what design features they'd like to see, what services they would like to see. But this is just listening session number one. We're going to be throughout the region. We're going to be asking you to follow the balloon. We've got a van that we're going to be traveling throughout, not just Kentucky, but you're right, Indiana, Ohio, all those places.
Trying to make it regional.
You bet.
All right.
And we're going to be there. We're going to have the same kinds of sessions, but we want everyone. We want to hear from pediatric patients. We want to hear from their parents. We want to hear from politicians. We'd like to hear from the community in general. Anybody that has something to say, we want to hear it.
All right, Cox, it's always good to see you. Thanks you very much. Good luck with the new project again next Tuesday at 6 at the elementary school.